Well, hello friends in YouTube land. Today's video is about how to use your SINEMET or carbidopa-levodopa, which is often used for Parkinson's disease, although sometimes for other things too. I'm going to focus on Parkinson's disease today. Now, SINEMET is the American trade name for one producer of a combination drug. It has carbidopa and levodopa. Those are the two chemicals in there. Levodopa is the kind of the raw material that once it gets into your brain is turned into dopamine, which is what's missing in a certain area, and that's why you get Parkinson's disease. So this is the raw material. Levodopa, it gets into the brain. It's absorbed through the intestine and then goes through the bloodstream, gets into the brain fairly quickly. The carbidopa part is the part that prevents the levodopa part from making you want to throw up. There's always two numbers with the SINEMET or the carbidopa-levodopa. There'll be like 25/100 or 5200 or something like that. Usually a 1:4 ratio or a 1:10 ratio. So like the 10 or 25 milligrams of the carbidopa is usually enough to prevent the levodopa from making you want to throw up. Occasionally, the ratio isn't quite right. Some people just might need more carbidopa, and we used to prescribe just carbidopa pills for them until the drug companies in the United States anyway recently decided that the price should go up to the stratosphere or beyond, and so now it's just ridiculous. Enough of that. But taking your SINEMET properly is very important, don't you think, doctor? Absolutely. So a couple of things about the SINEMET. One, obviously it's very helpful if it's taken regularly. Two, it gets into the bloodstream fairly quickly, so often when people start their day, they're going to want to take something right away. But three, and this is the important thing, is the levodopa part is an amino acid, and so if you take your SINEMET with protein, anything that has a lot of amino acids, which is what makes up protein, you're kind of giving a bunch of competing molecules, and so you're not really absorbing all of the levodopa very efficiently. So that leads to the recommendation, and this is probably recommendation numero uno, is take the medicine on an empty stomach. Very important. Empty stomach, right? Yes, 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 yes. Yes. So that means half an hour before food or 90 minutes after food, and you're pretty much in the clear. That means in the morning it might be easy. You might get up and take your SINEMET, your carbidopa-levodopa right away, and then in a half an hour you kind of have some black coffee, which has no amino acids in it. Or you might putter around and you get some breakfast, and by the time you have breakfast, things are okay. It's in your system. Very often we use the medicine 3 times a day earlier in the course of the disease. As the disease progresses, very commonly we wind up having to go up on the dose or more frequent on the dose in order to kind of get a steady state level in the blood, more or less. But at least early on, we're often using it 3 times a day. Second point about the carbidopa-levodopa. If you're taking it for Parkinson's disease, and if you don't have a lot of problem getting up overnight and walking to the bathroom or doing whatever you might need to do in the night, then taking it right before bedtime doesn't make a lot of sense, because when people are asleep, they don't have any tremor. Now, some patients find that when they get up in the morning, or if they have to get up to go to the bathroom overnight, they have difficulties because their daytime medicine has worn off, and so sometimes we'll prescribe more of a time release form of the carbidopa-levodopa to take at bedtime, and that can often sort of help carry over to the next morning or carry over into the night, so that if you're getting up to go to the bathroom, for example, it's easier and it's safer. In all honesty, it hasn't really proven to be quite as wonderful as we had hoped. So we had wanted a time release or sustained release formulation, but the reality is that the vast majority of the time, most of us treating Parkinson's disease are using regular carbidopa-levodopa during the day. the sort of smooth level around the day hasn't really panned out. And the regular stuff is really very predictable. It's much more predictable. Quick review. Empty stomach, 30 minutes before or 90 minutes after. Pretty regular dosing times. Probably not useful before bedtime unless there's a specific need overnight, or getting started in the mornings is really difficult. Generic medicine seems to work just fine for most people. A few other points. Very commonly, when we're sort of going up or down on the medicine, we'll go up by a half a tablet. And I'm speaking particularly of the 25/100 tablets, which are easily the most commonly used. So, and they're scored, you can pop them in half, and it works fine. So I hope this is a brief review of how to use the SINEMET that you find useful. Does everyone agree? Of course. I'm pretty sure that's right. Okay then.